Hello and welcome. Welcome to week 7-8 session. Okay, we're going to finish things out, and then, of course, next week is the final exam, and then you're ready to sit for your national certification exam. Oh, it's so exciting and scary. That's okay. We'll be with you right there all the way. Okay, so don't worry. All right, so this week we're going to talk about compliance plans. And, I'll tell you something. Sometimes compliance gets a bad rap. It's like, oh, you're such a goody goody. You got to follow the rules. Well, I want to say, first of all, yes, you have to follow the rules, but let's take that a little deeper and understand that the rules were created to protect people, to specifically protect our patients and protect the members of the staff and the facility as a whole. And you, as a staff member, as an employee, have a responsibility to ensure that our patients are protected. And isn't this exactly what you want when you go to the doctor or the hospital, or someone you love goes to the doctor or the hospital? The fact is that when you are working in a facility, regardless of your job title, you need to make certain that the rules are being followed, because the underlying fact is the rules are there to protect the patients and the staff. And our university, our college does not have a bail bonds fund for alumni, so going to jail or prison is really not going to, and it really looks bad on your resume, I'm just saying. Okay. All right. So let's look at compliance plans, because as you work your way through and you become a manager, a supervisor, this becomes more of your responsibility, not only for yourself following the rules, but to make sure that those in your department are following the rules. Okay. So compliance plans, it sounds so big and important, and it can be a lot of work when you're looking for the whole entire facility. But basically, this is the written policies and procedures manual. Okay, this is going to include standards of conduct, which you learned about in law and ethics. Okay, but essentially, it's going to outline, here's a situation and here's what needs to be done in that situation. So nobody individually in the facility has to worry about making the right decision, because it's already been evaluated, assessed, and determined for you. Okay? One of the first things in creating and implementing a compliance plan is to have somebody be in charge. And that would be to designate a compliance officer. This is your go-to person. And for ongoing adjustments and changes to the compliance plan, you would need a compliance committee, because this is something that needs to be done by more than one individual, especially when you look at, in the health information management department, you have individuals that are responsible for many, many different tasks, okay? Different jobs to get done. And so therefore, you're going to have different perspectives or different updates to what has to be done to keep the entire facility and everyone within it, patients and employees, kosher, as they say, okay? Part of this, making sure that everybody knows what to do in all of these different situations, is to provide education and training for your staff members. And this does often, again, on the departmental level, because you're the ones that know about coding, medical coding, the guidelines, the laws, the rules that have to do with making certain that you are compliant. You have to share that knowledge. And, sometimes, especially for those of you who are going through this program and about to graduate, you can get to that point where you're automatically assume that everybody else got the same education. But I think you probably experienced over the years with various different courses you've taken in high school and college and throughout that not everybody is given the same information. Not everybody is held to evidencing their learning, and not everybody learns in the same way. Okay? So you need to make sure that ongoing education, which is one reason why certification exams require CEUs, continuing education units, is because what you learned last year is not necessarily what is right this year, and on and on and on. And so it's very important that you take the responsibility to keep your own education up to date. But also, as you gain supervisory or manager responsibility, you are then responsible for those within your department. And further, a lot of facilities will require employees, those who are certified, nationally certified employees, to actually document their continuing education credits or units, as well as some facilities will support you financially. That they'll pay for you to go to a conference to get that updated education. So it's all part of the package, okay? Now, the manager's job, as you advance into managerial responsibilities, you want to make sure that you have effective lines of communication both directions, okay? So we just talked about the need for continuing education, continuing training, because we cannot assume that everybody understands, okay? But when we look at lines of communication, we have to look at that two-way street, okay? It's not just you sharing knowledge with those people in your department. It is also enabling your individual staff members to communicate with you if they have a question or if they observe. No matter how great a manager or leader you become, the fact remains that you cannot be everywhere all the time looking over everybody's shoulder, because that's bad. That's poor leadership. That's poor management, okay? You need frontline people to share that sense of obligation and responsibility for keeping things done correctly. And you need them to be able to feel comfortable enough to come to you and report when they see something suspicious, something that doesn't look quite right. Okay. Now, again, we're in 2021. So the fact is that most facilities have 800 numbers for anonymous reporting. And this is usually hospitals, large numbers. But the fact remains is that providing your staff members with the ability, the comfort level to report that they maybe possibly saw something. Maybe they observed something. You need that. To complement, and that's complement with an E, not an I, to complement, to go along with that sharing of obligation and responsibility with your staff members. We are in the age of technology, and there are ways to monitor and audit, retrospective audits, concurrent audits. Computers will monitor who accesses what record for how long, and the ability to track back to see if they had a legitimate reason to do that. There are lots and lots and lots of opportunities for this to be done in a covert, that's the word, in a covert way. In other words, you're sitting at a computer, the computer is watching you, not with the camera, but the computer is watching you. And this is important, again, because keeping a compliant healthcare facility means you are protecting your patients. And I mean, think about it. Do you want to be responsible for someone's death or injury? No, you don't. And a lot of times, those of us in HIM think we can't possibly cause somebody's death because we don't touch patients. We're not clinicians. But we are in charge of the information. And that is, remember the old saying, knowledge is power? Information is the foundational aspect of healthcare. Because if the physician and the other clinicians do not have the information they need about the patient, they can't. They can, but it is much more complex. It's much more difficult for them to provide effective care, okay? And what about when you look at the other part, where if the wrong codes are submitted, the claim gets denied, which means the patient has to pay out of pocket. And boom, all of a sudden, they're $10,000 in debt, and they had no idea. And wow, and the bottom line is if the coder had not made the mistake, the error, the insurance company would have paid. That is causing a patient harm. You didn't break their leg, but, you know, financial debt causes stress, which can cause a lot of healthcare issues. We all know that, especially after the last, we're almost at 2 years now with COVID. So it's really, 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 really important that we keep the facility, whether it's a one physician office, a walk-in clinic, or a big, huge hospital with 500 beds, it doesn't matter. The obligation is the same. So enforcing standards by making sure that there are not only guidelines, there are not only procedures, but we must have consequences. If any of you are parents, you already know that just saying to a child, don't do this, I told you not to do this, that's really not going to make the impact of consequences. Consequences like, you know, no video games for a day, or, you know, whatever is appropriate for the level. I'm certainly not talking about corporal punishment, but you understand there must be consequences. Dock a patient's salary, put them on leave, put them on suspension, fire them, depending upon what the issue was. But that is the teeth that goes with the law. And responding promptly to detected offenses and undertaking corrective action, which means, yes, if somebody tells you, I saw her just entering codes and submitting, and because she knows that if the claim is denied, it's not coming back to her desk, it's going to the denial department. We can't let that happen. And it's not fair to you, those of you who follow the rules, those of you who work to do a good job. There must be corrective action immediately. You know that, don't you? But it's hard. I understand. So let's talk about some tips for promoting compliance, okay? The compliance plans have to be a priority. If the facility does not have one, now is the time to start working on it. Okay? Doing a fraud and abuse risk assessment will tell you where your soft spots are. And that will give you the ability to highlight monitoring, auditing. You got to close that door. The financial relationships technically talks about vendors outsourcing anything, which your facility might do. Okay, but remember that the original facility is still legally and ethically obligated for all of the actions that are taken by an outsourced vendor on their behalf. So you're not passing along the responsibility or the obligation. You are sharing the task, but you still hold on to the obligation, to the responsibility. And here is an 800 number for the Department of Health and Human Services to report suspected practices. So this is good, is if you notice something that is happening in your facility and you go to your management, your supervisor, you report it and nobody does anything, you need to report it to HHS. Now, again, I know that the first response is going to be, well, I don't know if I'm right. What if I'm wrong? I don't want to put them in jail. You don't have the power or the authority to put anybody in jail. All you're doing is sending up a little red flag that says maybe somebody who knows something should look into this, because the way I was taught, that's not wrong. I mean, that's not right. That's all you're doing. You do not have the authority or the ability to send anyone to jail or prison. You do not have the authority to fine or penalize anyone. You do not have the authority to shut anything down. All you're saying is, I noticed something, I'm not sure. Somebody needs to look into this because I want to protect my patients. I want to protect myself. And when in doubt, ask for help. There's got to be somebody you trust. Call the 800 number. If you're not sure, they can tell you, oh, well, I appreciate you calling, but that's not that. Okay? That's good. When in doubt, ask for help. All right, so this week's chapter readings, we're going to finish this up. Chapter 10, Business and Inpatient Facility, and Chapter 11, Compliance in the Facility, which we just kind of sort of went through, but you want more. There will be questions on the certification exam for this topic. Absolutely. All right, and then of course you have your chapter quiz covering both chapters. Do not use your textbook. You want to really check what you have in your head, because your head, your brain, you know, those wonderful brain cells, that's all that's going with you to the certification exam. Okay, so this is a safe place for you to really check what you're learning. And then you can fill in those gaps before you sit for the national certification exam. And part of that learning is this analysis. I have noticed, I've given you all feedback for your analyses, but the most important thing for you to go through this is to really learn. And I will tell you, one of the things most often that I had to write in a feedback box for your analysis is, now is the time, now is the perfect time, now is the time for you to, what? To get in the habit of double checking what you type into an exam. Make sure that's what you meant to type, and then hit the submit button. Okay? Not only is this proper testing or exam behavior, this is very important for when you get on the job. When you get on the job, You need to make sure those claim forms have the codes that you meant to type in or that you meant to click on, depending upon how you're creating these claims. Those reports that have to go to the Joint Commission or CMS or anyone else. We all are human. It's easy to be in a hurry and hit the wrong key. It's easy to do that. And it only takes a couple of seconds to go back and check and make sure that's what you typed in. Okay, then you can move on. So this is what you need to learn from these analyses. So very, very, very important. All right, also included in your course room for this week is our healthcare compliance tips, which is what we went over, as well as guidelines for compliance plans that can help you better understand the entire process. Okay, maybe this is your future. Risk management is very exciting, and that includes compliance. Yuppie, yuppie, yuppie. All right, don't forget your final exam is, you have 2 days in which to complete this. It'll only be open Thursday, December 9th and Friday, December 10th. You have 2 hours to complete 30 multiple choice questions plus 5 case studies, and it will use Respondus Lockdown Browser. As soon as possible now, right this second, you want to complete that practice, okay? The practice is one question, like what color is the sky, all right? It's only to make sure that your technology is ready for Respondus Lockdown Browser. You don't want to start the test and have something technical become problematic, because that will eat into your 2 hours. And then it becomes a whole thing, okay? The final exam is worth 20% of your final grade. So that's a lot. That's 2 grade point letters, okay? All right. In the meantime, I am here for you. I am here for you 7 days a week, not 24 hours a day, but yes, 7 days a week. Email me, we go back and forth and I'll answer your questions, or we can set up an appointment to speak on the phone, or we can set an appointment to Zoom one-on-one or FaceTime, whatever. I also do WhatsApp. Okay, I'm here to support you, and I share in pride and being proud of you for your success. Okay? We're in this together. Don't forget.